Welcome to The Coalition. This is a talk show dedicated to discussing health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave. Hello, everybody. Welcome to The Coalition. I'm your host, Dr. Shani Belgrave. I am a bariatric and minimally invasive surgeon in Atlanta, Georgia. You can learn more about me and get connected at www.drshanibelgrave.com. I am super excited to have on the show today Dr. Gabrielle Williams. Dr. Gabrielle Williams is a family medicine doctor and owner of Gateway Direct Health. She's here to let us know about the direct primary care model and some basic primary care health issues. Dr. Gabrielle Williams, thank you so much for joining the coalition.
Hi, thank you. Thank you so much, Dr. Belgrave. It's an honor.
Awesome. Super excited that you're here. So can you please get us started by telling us a little bit about who you are and what you do?
Sure. I am a board certified family medicine physician, but in addition to that, I am a mother of two, and I've been married for almost 12 years. And I am the owner of Gateway Direct Health, a membership practice here in Atlanta, where we're providing healthcare the way it should be: accessible, timely, and hassle-free.
Wonderful. So this is perfect. So I'm hoping you can give people some insight and information on some very common diagnoses that people present to the PCP with. So the very first one is going to be back pain. What can you tell us about back pain?
So back pain, we kind of split it into two causes, right? Mechanical, meaning to do with the musculoskeletal system, the muscles, the bones, the joints, and non-mechanical, which are, can be from inflammation or, unfortunately, God forbid, but from cancer. So when we discuss back pain, we're really big on trying to figure out, which of the two causes is going on for the back. And then when we do our exam, we're able to try to see, hey, is there weakness associated within the legs? Because there are some pretty serious causes of back pain, not just from, overuse or not bending at our knees, instead bending at our back. Like, that can cause back pain. But we're also looking to see if the nerves are involved. Is there a fracture? Is there potentially, like I said, cancer in there? So that's how we separate back pain, and then we do our history and exam to figure out, okay, what is the cause? And of course, as physicians, we're really big on trying to make sure that there's no emergent or very serious cause. So that's like the first things that we'll rule out, and then we'll go, in order for figuring out the back pain.
So what sort of workup might you do? Is there any imaging or?
Yeah, so depends. So if there is significant trauma, we would go straight to imaging to take a look at the bones and joints, of course. But if there's not a significant trauma or red flags, or what we consider red flags like weight loss, fever, we will assess. And if we think it's like a common back pain through mechanical injury or mechanical reasons, then we'll we strongly recommend physical therapy. We strongly recommend modifying activity, but not stopping activity altogether, right? Our bodies were meant to move, so we want to move, but we may need to modify that activity so we don't re-injure the area, but strengthen people in that.
And so how much time would you give with physical therapy?
Ooh, that's a great question. So again, depending, but it could be, 4 sessions of physical therapy, or they may need 12. It all depends. So we work with a physical therapist when they do their evaluation and treatment, so we can determine how long they'll have to do it. And of course, reassess every so often to see, are we going in the right direction? And if we're not, what could be potentially hindering us from going in the right direction? Maybe it's a different cause than what we think we're treating.
Got it. Another very common ailment is headache. Some people also are dealing with migraine. So how would you counsel a patient that suffers from, there are different types of headache, tension headaches, cluster headaches, migraine, but can you kind of give us some information on people with headache? What should they do?
First thing, things that you can do: check your blood pressure. Like, that is a very common reason why people have headaches, is because of their blood pressure. And sometimes that might be the only symptom you have. You might not have symptoms at all, but that might be the only symptom you have. And oftentimes when people check their blood pressure at the time when they have a headache, it's usually up. So that's one of the things I want people to feel empowered, like what they can do about their headache. The second thing is keeping a headache diary. This helps all of us, right? The patients and members of the practice, and me as a physician to figure out what's going on. So the common reasons why people have headaches or triggers are diet issues, excuse me, or nutrition issues, and sleep. Those are the
Mhm.
most common things, or stress, right? Stress management. And so when we recommend taking a diary, what did you eat? How much fluids did you drink? Hydration status. What kinds of things were you doing around the time that you have a headache? You know, maybe you didn't sleep well for 2 days and then you developed a headache. It's very important to take a diary so that we can all figure out what's going on. And of course, looking for red flags, like we talked about, where again, we're looking for more serious causes. So if there's weight loss, if you're having weakness or numbness on one side of your body, if your vision is changing or completely going out, like that's a reason or a big cause for concern. But taking a diary, checking your blood pressure, you know, are big things that people can do to figure out what's going on with the headache. But then also, we're definitely empowered to take care of those headaches, especially the common ones, right? By making sure we drink enough water, making sure we're eating well, and making sure you're getting adequate sleep.
And so, what distinguishes just the occasional headache from migraines?
Ooh, great question. So migraines tend to happen when we're younger, adolescent age, tend to run in families, usually, tend to run in families. And migraine headaches usually could last, you know, a few hours to days, and they're associated with nausea, vomiting, light sensitivity. So if the light is shining in your eye, it can worsen your migraine, sound sensitivity, and usually people have to go in a dark room, kind of just like need like a dark room that's quiet in order to help de-escalate that headache and to feel better. And then, you know, common triggers, stress, right? Lack of sleep, all the things. Versus other headaches, like tension headaches tend to be around the temples. They can even happen in the back of the neck, and are associated with stress.
Right. Another common symptom is the cough. So, what can you tell us about the significance of that symptom in terms of causes and how long to monitor versus when to really get in and see your PCP?
Oh, listen, these we're going into the season of winter flu, COVID. Shoot, COVID even started a few months ago. Say, hey, I'm coming early, and other viral infections, right? So we separate coughs into how long they last. So there's an acute cough versus a chronic cough, and usually acute coughs are lasting less than a few weeks, and they're associated truly most of the time with viral infections, asthma attacks. Right, if someone has a known history of asthma, they start coughing and wheezing, that can be a sign of an asthma flare. And then we have our chronic coughs, especially if you have a history of smoking, we're thinking about COPD or chronic obstructive pulmonary disease, where the lungs are affected from usually tobacco and therefore cause like a chronic cough. We look at medications potentially causing cough, right? Like lisinopril, which is a famous blood pressure medicine that can cause chronic cough. And then, of course, we're thinking about the serious things. We're thinking about cancer. We're thinking about inflammatory diseases that are affecting the lungs. You know, those are also causes for a chronic cough typically.
So, I just thought of something like with lisinopril as a side effect. Can that cough develop after you've been on it for years, or is it something that if it's going to be a side effect, you'll have it upon initiation of the medication?
Great question. Usually, right, like it's time dependent, right? Someone starts a medicine and then you can see the side effect, but that cough can develop later. Interesting.
Mm,
Yeah. So we try to
fascinating.
do the whole workup and, you know, check to see if there's any other cause for the cough. But they
Mhm.
might have to do a trial of being off the medication, and if there's improvement, you know, you might have found the culprit.
Exactly. So, what can you tell us about arthritis?
Ooh, it's coming for everybody. Just kidding. Arthur is visiting everyone. I love how people call it Arthur. It's hilarious. But yeah, arthritis, you know, but it's not just a symptom of being older, but arthritis is basically inflammation of the joint,
Mhm.
and it's usually degenerative, again, wear and tear of the joints, and it can affect every single one, right? Your neck, right? That's a common reason for people to have neck pain is because there's inflammation, arthritis of the neck, of the spinal cord, not spinal cord, but the yeah spinal. Also, the knees. Common reason for people have knee replacement, hip. Common reason for hip replacement is because of arthritis or the wear and tear of the joints. People can even get it in their fingers. People with inflammatory diseases like rheumatoid arthritis, lupus can have arthritis of their fingers. So, it's from an systemic, meaning a whole body um, inflammation, then that would lead to maybe steroids and other medications to help decrease inflammation. But our degenerative arthritis or wear and tear arthritis, surprisingly, it gets better with physical therapy. I know people are like, but it's painful. How can it get better? Or how can you tell me to exercise it? But those are the things, like, again, our bodies were meant to move, and we're helping to strengthen our muscles around the joint to protect it. Now, does not mean that you should go on the pavement and start running, right? Like that will definitely affect your knee joints specifically. But water aerobics, we're still moving our legs. We have less pressure on it from it's not concrete. We're in the water, but we're still moving. We're still getting some improvement with exercise or physical activity.
And then the next thing I was going to talk to you about is urinary tract infections. So, what would you say are the signs, symptoms, and are there certain things that people can do to decrease the likelihood of getting urinary tract infections?
Yes, yeah. So most people at risk are women because the distance between our urethra, where's what the whole opening where pee comes out, compared to where our rectum is pretty short compared to men. And so, unfortunately, that means that bacteria has a easier course to get into the urethra and cause havoc, right? And start to irritate the bladder and cause infection. So most common symptoms are, increased urination frequency. So we're going to the restroom a lot, belly pain, lower pelvic pain, pain with urination. So those are the common symptoms of UTI, and it's usually developing over days, not weeks and months, but over days for acute UTIs. And the common treatment is antibiotics, right? Like it is an infection caused by a bacteria and needs to be treated accordingly with antibiotics. Um, Things that people can do to prevent is to make sure to pee after sex, to wipe from front to back. I know that, we're all grown and stuff, but a reminder, wipe from front to back so we're not introducing bacteria in the wrong direction.
And what about cranberry juice? Is that prophylactic at all? Drinking cranberry juice? Any truth to that?
So there's the data that is not supportive of that, but we do hear a lot that people do drink cranberry, or even I think they're the cranberry in a pill or something like that, where it takes like the acidic properties, and people can take that. Some people, I think anecdotally, people say that it's helpful, but I don't think there's data to support it.
All right. Well, thank you so much, Dr. Williams. Can you please talk to us about your practice, Gateway Direct Health, kind of its inception, your philosophy on direct primary care?
Sure. So direct primary care or concierge medicine is a membership-based model. And I know people are like, well, why even do something different? But unfortunately, the traditional healthcare system, specifically, I'll talk for primary care, is not great and needs to be redone completely. Unfortunately, with insurance, they continue to decrease reimbursement to primary care physicians. And with that, and also being with large healthcare organizations, we're having to see more and more people in order to meet overhead and profit. So unfortunately, we tend to feel like we have to see 20, 25, 30 patients a day. The problem with that is primary care is very relationship based, and it's hard to develop that relationship in a small amount of time with people. And from the patient's perspective, they're waiting months for an appointment, right? Because we're not seeing a lot of residents go into primary care. So there's fewer primary care doctors relative to what we need for the population. And so people are waiting longer to see a doctor. And when they're in the office, they're waiting even longer to come in to see the doctor. And then when they do see the doctor, unfortunately, it's a very short, truncated appointment. And there's not a lot of time for asking questions, getting their questions answered, going deeper into what this medication is. Like, it's very, all right, I'm going to prescribe you, I'm going to give you something, right? I'm going to prescribe you something. That's a lot that I heard. I'm going to give you something without explaining what the medication is, how it's potentially going to affect the person, and what could the person do to empower themselves, right? Are we spending the time to talk about what diabetes truly is and how their nutrition affects it, right? We give a short version. Oh, make sure to eat less sugar. Make for your blood pressure. Make sure to eat less salt. But I think if we had more time, we would give more education and again empower people to make those changes and guide them in those changes, and can focus on preventive care and lifestyle management. So I pivoted and started my own practice because I got tired of that, as well as the burnout, and moral injury. And so my husband was like, all right, well, if you wanted to start your own practice, what would it look like? And I said, oh, I would know my patients. They'd know me. I'd spend time with them. I'd be able to educate more. And then I would be on retainer. So if they needed me, they'd be able to come in quickly. And I did research and found out that was called direct primary care. So with this membership model, it allows us, the members pay a monthly or annual fee, but it allows us to be their personal physician. They're not having to go through 10 other people in the practice and tell their story over and over again. It allows us to build trust, because I think that's lacking, unfortunately. People do not trust physicians like they used to. So with having one physician and having the ability to spend time with them, 30 to 45 minutes, and being able to get in to see them when you need to, and not having to rely so much on urgent care and emergency room for non-emergent and non-urgent issues. Like, we are building a relationship, and what we see in the studies, it shows people who have primary care doctors are healthier and they're living longer. People who have primary care doctors that are culturally competent, fare better than those who don't. And so the studies show that. And so this model allows us to put it into practice in a different, revolutionary way that I see that more and more doctors are doing. According to, I think, this American Academy of Family Practice, about 10% of family medicine doctors are direct primary care doctors. So there's definitely a push and a movement towards this model. Is it the end all be all for healthcare? No, because I don't think so, because we have a smaller panel. We need to find a way to serve more people. However, I think it'll be enticing for medical students choose primary care. They're like, okay, this is more sustainable way of providing healthcare as a primary care physician. So long answer, it's a membership model, but the reason for that long answer is to get people to understand why the shift, and what we hope will be the benefit, and what we seem to be the benefit for members.
So, for patients that don't have much in the way of health problems, is it still the same membership as someone that has multiple medical issues that needs more frequent visits?
Right. Yes. So at least with my practice, there are some practices that do delineate depending on health conditions, but I didn't want to provide potential bias and discrimination based on health status.
Mm-hmm.
Surprisingly, most of the people in my practice are young professional or entrepreneurial women who have few health conditions.
Mm-hmm.
And I asked, I'm like, hey, because I'll be honest, I thought this was for my diabetics, hypertensives with stroke and heart attack, and then also people who didn't have insurance. I thought they would run to this, because I'm like, this is the care you need. Yet it's people who, surprisingly, again, it surprises me, who joined the practice. So I asked, why do you join? They said, I need someone who's going to listen to me. And
Hmm.
to me, that's impactful and deep because it seems very small reason to pay, in addition to your health insurance, right? To pay this membership fee. But they're saying, like, this is the kind of level of care that I need. And that's what they're looking for, someone who's going to listen, but also who's going to be available and who's not going to judge, who's not going to dismiss them. I think I hear that a lot. Who want they want one member said, you create a safe space for me, right? Because they may consider, they're healthy and stuff, but people, they go through little things like dizziness, or have this chronic abdominal pain that they just ignored because no one took it seriously. Like, there are still things happening that maybe they've ignored for so long, but now they have a space to say, okay, this is really what's going on, right? I know I said I was healthy and everything, but this is really what I'm dealing with. I'm dealing with perimenopausal symptoms. I'm having chronic fatigue, and I don't know where it's coming from, and hot flashes, but I still have my periods every month, right? And everyone tells me it's fine or it's in my head, but I'm still suffering. Like, I think, um, I'm grateful and humbled, and I thank the Lord for this, that I'm able to create a safe space for women and men to be able to say, okay, truly, this is how I truly feel. And then at the end of it, thank you for listening and taking me seriously.
Well, that is very important. Do you see children in your practice?
No, ma'am, just adults. But
Okay.
some people try to sneak some kids in. I'm just kidding. Who's 16 and up? How about that?
And then the other thing I was going to ask is, in your model, do you take any insurance or you do not take insurance?
Ooh, great question. We take all insurance except for Medicare, and we use it for the patient's medications, their labs, referral to specialists, right? But we don't get paid through insurance. They pay the membership model. So if you have Blue Cross Blue Shield, United Healthcare come through, Medicaid, CareSource come through. We just don't get paid by it, but we welcome everyone.
Wow, this was really informative. For people watching that want to learn more about you and get connected, what's the best way for them to reach out to you?
Oh, yes. Instagram. So I'm Dr.Notmiss, so Dr.Notms. And they can DM me. We do a live every Tuesday night at 9 p.m. Eastern. But you can also take a look at our website at gatewaydirecthealth.com, or email us at info@gatewaydirecthealth.com.
Wonderful. Well, thank you so much, Dr. Gabrielle Williams. I'm excited for what you're doing with your practice. I hope to see you
Thank
back on
you.
the coalition another time.
Yes, thank you, Dr. Belgrave.
Well, everybody, thank you so much for tuning in to another impactful episode of the Coalition. Very special thank you to Dr. Gabrielle Williams, family medicine physician and founder of Gateway Direct Health. You can get connected with me at www.drshanibelgrave.com. You can get connected with Dr. Gabrielle Williams on Instagram at Dr. Not Miss. Thanks, everybody, for watching. Please make sure to share this episode with friends and family. We'll see you next time.